The economics of cooling hot classrooms as school opens for the fall.
Marketplace Morning Report is supported by Schwab. Schwab offers investors choices like full-service wealth management, self-directed investing options, and trading on Think or Swim. More at schwab.com.
I'm David Brancaccio in New York. Students are returning to school now, and for millions, classrooms are hot. More than 10,000 schools nationwide don't have air conditioning, according to the Center for Climate Integrity. 93 degrees will be the high in some places in the Midwest and eastward today, and some schools are releasing students early or closing altogether this week. Marketplace's Daniel Ackerman has more on why schools lack AC.
Back when many schools were built in cities like Philadelphia, Cleveland, and Chicago, air conditioning wasn't really needed during the school year. Now, though,
we can't fight off the hot weather by opening a window anymore.
Travis Roach is an economics professor at the University of Central Oklahoma. He's found that classroom heat is bad for student test scores.
It's harming our productivity. It's harming our learning.
But adding AC can cost hundreds of millions of dollars for large school districts, says Paul Shanowski, emeritus professor of engineering at UC Boulder.
This is one of the toughest problems that's out there because we have such local authority in schools.
He says some districts issue bonds to pay for AC, but that's not an option everywhere.
It's a real equity problem then that you're creating districts that can afford it versus districts that not.
Shanowski says the COVID stimulus helped some schools with AC, but it didn't move the needle nationwide. I'm Daniel Ackerman for Marketplace.
Dow and NASDAQ futures are both down about 0.2% now. S&P futures are down 0.1%. The Federal Reserve's preferred reading on inflation, it's called personal consumption expenditures, comes this Friday. The big unemployment report comes a week after that. Albertsons and Kroger want to do the largest supermarket merger in U.S. history, a $25 billion deal. But federal regulators have sued to stop it, saying the combination would be too big with 5,000 stores under one management and would hurt competition and possibly drive up prices. At a hearing that started in Oregon yesterday, an Albertsons lawyer warned a judge there could be layoffs and store closings if no merger. The Federal Trade Commission is looking for a preliminary pause to the merger. The FTC lawyer says Kroger and Albertsons currently compete in 22 states, closely matching each other on prices and services. The supermarkets also want to merge to help fight Walmart, Costco, and Amazon.
Marketplace Morning Report is supported by C3 Generative AI. C3 Generative AI enables rapid access to secure, traceable, hallucination-free insights from enterprise systems, all while using any LLM, helping enterprises turn the invisible into the obvious. C3.ai. This is Enterprise AI.
Nearly 1 in 12 adults owe medical debt, according to the health policy research group KFF. About 14 million people owe more than $1,000. 3 million owe more than $10,000. It's an issue in the presidential campaign. Kamala Harris wants to cancel medical debt for millions of Americans. Donald Trump has not focused on medical debt during his campaign, although in January he said he'll, quote, fight for much better health care than Obamacare, calling the Affordable Care Act a catastrophe. This is happening as a growing number of states are taking action on medical debt. Marketplace's Sabri Benishore spoke with Kim Nichols Downer, a professor and director of healthcare management at the University of Minnesota, Duluth.
Just this past Tuesday, the governor of New Jersey announced that $100 million worth of medical debt would be erased for about 50,000 people in that state. Connecticut and Illinois doing something similar. Vice President Kamala Harris has called for more of this. How does that work? How does that get paid for?
So generally, those are taxpayer dollars going to pay off the medical debt of others. And so it's kind of a one-time infusion of cash to paying down the debt of people.
How effective is that kind of policy? I ask because it's one thing to get rid of debt one time, but doesn't prevent future people from falling into future debt in the future.
Right, absolutely. So on top of that, states need to put efforts together to really create good policy around medical debt that really helps people to avoid it and prevent it altogether. So while it's great to take care of the people currently with medical debt, ideally we want a situation where people are not getting into medical debt in the first place.
Why is it such a persistent problem?
Some of it has to do with the variation that different payers pay for different services. So if you took one particular service at one particular facility, every different payer would pay a different amount for that. And that variation can be sometimes on the order of 5 times, right? One payer might pay 5 times more than another payer. And then on top of that, it's not always clear what burden of that becomes the consumers. So helping decrease some of that variation in payment on health insurers would be one thing that could be done. Requiring more transparency in terms of who qualifies for financial assistance, how a person can obtain financial assistance, expanding the scope of that financial assistance. So all these things really play a role in helping people to never have medical debt to begin with.
Medical debt, medical costs, this is an issue that states have already been taking on. As I mentioned, some states have outright forgiven some medical debt. Others have other strategies. What are some of the ways that states are tackling this problem that a federal government, a presidential candidate might want to pay attention to?
Yeah, they're strengthening requirements for financial assistance. So making sure the hospitals are transparent. Sometimes they're expanding the venues for where people can get financial assistance. So looking beyond hospitals to like freestanding orthopedic centers, for example. They're putting more requirements on community benefit. So nonprofit hospitals get a tax break. So making sure that that money actually is going to pay for care for individuals. They are regulating hospital and debt collectors' billing and collection activities, looking at things like whether a hospital can sell that debt and to whom, regulating the practices of those places that they're selling the debt to. They're also putting limits on the ways in which debt collection works in terms of like foreclosures and wage garnishment. And they're also working on developing state level reporting systems. So we don't have a lot of data to understand what's going on with medical debt and who's getting the benefits of financial assistance and is it working for all people effectively. So states are kind of working in those areas, and I think that's going to give us a lot of good information for possibilities for federal legislation.
Kim Nichols Downer is a professor and director of healthcare management at the University of Minnesota Duluth. Thank you so much.
Thank you for having me.
That's Marketplace's Sabri Ben-Achour. I'm David Brancaccio. This is the Marketplace Morning Report from APM, American Public Media.